The stigma behind holistic approaches to addiction treatment. This is fighting the holistic treatment stigma, and printed in healthyliferecovery.com. Choosing the right approach to substance use disorder can prove incredibly important. If you take a treatment option that does not work for your specific needs, you may find yourself falling back into addictive patterns and behaviors, or struggling with the same issues repeatedly. Unfortunately, many addiction treatment centers offer a one-size-fits-all approach to addiction treatment, which can leave patients struggling to get the support they need as they recover. A holistic approach to addiction treatment can help improve overall outcomes. What does holistic mean? Holistic means the interconnected whole of something. Alternative medicine and treatment deal with a whole person approach to treatment rather than simply focusing on a single problem. Addiction is a whole person problem. As many as 60% of people with substance abuse disorder have an underlying mental health condition. As many as 70% of adolescents with substance abuse disorders have a trauma history. Patients with ADHD can prove up to 3 times more likely to suffer from a substance abuse disorder than people in the general population. People with mental health conditions, trauma history, or other concerns will often attempt to self-medicate with drugs or alcohol. Without treating those underlying conditions, many patients cannot experience the improvement in symptoms or decrease their overall struggle with addiction the way they could if they addressed the underlying challenge that may have led to those addictions and problems in the first place. Physical treatment. Sometimes treating addiction means taking a comprehensive look at any physical challenges that may be contributing to addiction. For example, many patients struggling with addiction may have underlying chemical imbalances in the brain, which can in many cases be resolved with medications and therapy. Taking care of physical treatment for addiction may also mean medications that can help address withdrawal symptoms or physical discomfort in a patient who may have used drugs or alcohol to self-medicate. Mental emotional treatment. Mental and emotional treatment for addiction can help address the challenges that may have caused the patient to fall into an addictive spiral. In many cases, patients suffering from addiction lack coping mechanisms to help them cope with the feelings or challenges they may experience without turning to drugs or alcohol. During a holistic addiction treatment program, patients will address any underlying emotional challenges that may have contributed to addiction and develop coping mechanisms to help them deal with mental health challenges and concerns without turning to substances. Spiritual treatment. For many people, treating the whole person is part of a comprehensive addiction treatment protocol. Means a look at the spiritual side of that addiction. Spiritual treatment may involve a look at the patient's soul or higher self, including evaluating the patient's spiritual connections and beliefs to develop a solid treatment protocol and understanding of the patient's overall needs. A holistic style treatment does not stop simply offering the physical support a patient may need. It also provides support in the emotional and spiritual elements of overcoming addiction. The holistic approach to addiction treatment looks at the patient as a whole person, which can effectively address these symptoms. What does holistic treatment work? An estimated 45% of intravenous drug users in one study reported using at least one type of alternative therapy, including a religious treatment program to help address addiction. Alternative and holistic approaches to addiction treatment may include things like prayer, herbal treatments, breathing methods, and meditation and mindfulness. In addition, holistic addiction treatment involves looking at potential underlying challenges that patients may face and how they are contributed to that road to addiction. Often dealing with those underlying challenges can make it easier for patients to address the symptoms of addiction. These holistic treatment approaches may bring more to the table than a traditional approach to addiction treatment, which may not consider the full range of challenges patients may face as they address addiction and determine their next steps. Relapse following traditional treatment programs. Following a traditional treatment program, relapse rates are as high as 65 to 70% of patients. Patients may relapse for a variety of reasons. Often that relapse occurs because the same problems and challenges that led to addiction in the first place do not go away once the patient leaves rehab behind. Patients may head back into the world assuming they can now cope with those challenges. Unfortunately, they may find that they do not have the resources they had hoped for, or that they fall into the same behavior patterns. Mindfulness and addiction treatment can help. As part of a holistic treatment approach to addiction, mindfulness treatment can go a long way towards decreasing relapse rates and making it easier for patients suffering from substance abuse disorders to cope with the challenges they may face when they get ready to resume their normal life patterns. Mindfulness treatments encourage patients to think about why they engage in certain behaviors and to prepare ahead of time for the results of those behaviors. As a result, many patients find themselves better equipped, in general, to deal with those challenges, including being exposed to the substances they were once addicted to, or to the circumstances that previously led to addictive behaviors. Is a holistic treatment taboo? For some people, any treatment that considers addiction's mental or spiritual side is considered taboo. Instead of acknowledging the challenges that patients may face and the benefits they may receive from a holistic style treatment, these people may assume that a holistic and spiritual treatments will not work. Addiction treatment requires a mind and body approach to treating the substance abuse disorder and supporting the patient. Addiction is not just a physical ailment or a weak will. Instead, addiction can result from several challenges, including mental health disorders, trauma, personal challenges, self-medication, physical conditions that may increase the risk of addictive behaviors. Recovering from addiction is not as simple as the detox process alone. Detoxification can remove the drug from the patient's system, but it does not address any of the challenges that may have led to the addiction in the first place. Unfortunately, many people steer their friends and loved ones away from holistic style treatment because they believe it will lead to spiritual nonsense or false hope, and a variety of other challenges that are born out of bias. How well does holistic treatment work? Holistic treatments have become increasingly important for a variety of health conditions. What a patient eats, the patient's activity level, and the overall mental wellness can substantially impact the patient's recovery from various severe health conditions and disorders. A positive mental outlook can be essential in recovery from various mental health conditions, including addiction. Holistic treatment aims to address those concerns. It provides patients with a multifaceted approach to addressing addiction. Therapy. Most treatment for addiction starts with ensuring that the patient receives therapy geared towards developing coping mechanisms. Individual and group therapy can be critical for helping a patient identify dangerous thought patterns and behaviors and effectively address them. Therapy serves as the foundation of holistic treatment programs, as well as more traditional treatment programs. Exercise and activity. Part of a holistic recovery often means increasing overall activity levels. Exercise can have several critical mental health benefits that cannot be ignored in the journey to addiction recovery. Patients suffering from substance abuse disorders may find that exercise helps give them something else to focus on and a new routine that adds structure to their days. In addition, exercise can help patients suffering from substance abuse disorder connect with others, including those outside their addictions. Often, people continue to engage in addictive behavior after leaving rehab because they reconnect with the same people who helped pull them down into addiction in the first place. Exercise, including participation in various team-related activities, can help improve the sense of connection to people and offer more socialization that's healthy during and after recovery. Athletes are certainly not immune to addiction, and engaging in those athletic activities regularly can provide patients with a positive outlet that may improve their odds of recovery. Mindfulness and meditation. Mindfulness and meditation often play a heavy role in overcoming addiction. In addition to passive meditation, patients may benefit from activities like Pilates or yoga, which can help improve the mind-body connection and improve addiction recovery efforts. Mindfulness and meditation are part of a holistic recovery process that can help improve recovery and provide more mindful decision-making skills. Music therapy. For many patients, music can have immense benefits. Most people do not consider music therapy part of a comprehensive recovery program. Music offers several benefits that can help with overall mental health and wellness. Music can be used very effectively as mental health intervention. People who listen to music regularly may find it easier to address mental health concerns, including depression and anxiety. Furthermore, music improves immune response, stimulates certain brain areas, and more. By using music as part of a holistic treatment approach to addiction, many patients can see better overall outcomes. Creative expression. Many patients find creative outlets essential as they recover from addiction. Patients often have trauma to work through and process as they recover from addiction. Patients may choose to draw, write, paint, or engage with various artistic media as they aim to process the conditions that cause trauma and use their new knowledge to help recover from addiction-related challenges. Creative expression can also give patients an essential dopamine release and provide a constructive way to use energy. Diet. What a patient eats can have a powerful impact on overall recovery. Unfortunately, diet is often overlooked in treatment from traditional health disorders and mental health conditions, including addiction recovery. Many people who suffer from drug and alcohol addiction will limit food consumption during those periods of addiction, which can lead to malnutrition and other challenges in the recovery process. Furthermore, a healthy diet is essential to maintaining mental health during recovery. Often a diet high in sugar or short in essential nutrients can lead to its own set of mental health challenges. Taking a careful look at a patient's diet can often help provide mental health support to help the patient avoid relapse. Diet can also prove critical in fueling physical activity, which may and should be a vital part of recovery. Because holistic treatment often aims to look at all of the pieces that can work together to create the addictive cycle, it may put patients in a better position to recover fully. Holistic treatment and the stigma behind it. A certain stigma behind holistic treatment suggests that it may not only offer an effective recovery strategy. Many people assume that recovering from addiction has to be hard work, and it certainly is. Addicts must put in time and effort to overcome addictive behavior. Part of that process over addressing the conditions that may have caused the addiction in the first place. A certain stigma behind holistic treatment suggests that it may not offer an effective recovery strategy. Many people assume that recovering from addiction has to be hard work. Part of the process means addressing the conditions that may have caused the addiction in the first place. For many addicts, it's rush associated with drug use, often opioids and other addictive substances, to substitute for the endorphin rush that they cannot get in other circumstances, particularly if they struggle to get their brains to produce and release those essential chemicals. As part of a holistic treatment program, patients with substance use disorders can find a healthier way to release those endorphins and experience that rush. They may try music, creative expression, exercise, a host of other activities, all of which can help provide an outlet for those emotions and help with overall mental health. Unfortunately, many people do not believe in the essential effects of that holistic approach, which means that they forego vital treatment methods that could help them get the essential dopamine and endorphin release needed to improve functionality. Holistic therapies can be combined with evidence-based therapies to be an effective form of treatment for addiction to drugs and alcohol. Holistic treatments focus on treating the individual as a whole rather than the addiction alone. By using treatments like yoga, meditation, and exercise, addiction treatment can be much more comprehensive.